Hey everybody, Ryan DeWitt here from DeWitt Physical Therapy. Today I want to take you through a couple of simple and quick hip mobility screens that we use to pick apart people's squats. So if you were to come into the clinic and say, Ryan, help me with my squat, I'd say, well, let's first check and see if you have the basic range of motion. So let's start actually with just going over what the needs of the hip are for a perfect squat. So if we get you standing with your feet about shoulder width apart, your toes can be slightly turned out, kind of as the pressure relief valve on the hip. And we just think about sending our butt back and our knees out, and we're going to try to keep our torso upright, spine straight, and try to squat down to get our hip crease just down below our knee, and then be able to stand back up. That hip has to be able to come up into flexion and external rotation. There's some other factors involved, not just the hip when it comes to a squat. How do you control your hip and your core? What's your ankle mobility like? Lots of things. But from a basic standpoint, you need to make sure that we have at least the requisite range of motion in that hip in order to get in that position. At least that would make sense, right? Okay, so screen number one, we're gonna get you into this big extended lunge. We call this like a Spider-Man position. We're gonna see if we can take this elbow and put it all the way down on the floor into this instep. So here, this is one check. My foot stays flat on the ground. If you're a few inches away, it's just nice to be able to kind of take note of that. Of course, we'll compare it to the other side. We don't want pain through any of these. Tightness is okay, but pain would be bad. So same thing, can I go down and drop that elbow down to the instep, and I can check that box on both sides. The next one, I'm gonna have you lie down on your back. And what we're gonna do is cross one ankle over that opposite knee, and then you're gonna let that knee fall down towards the ground. If I keep my pelvis nice and level, that knee shouldn't be more than about 2 fist widths from the ground. Or if you want to think about this shin bone here being pretty horizontal, that would be great. But like I said, about 2 fist widths here off the ground. And of course, we'll check the other side. So if you notice, and you're actually following along at home, you might notice that my left side is a little bit more higher off the ground. That shin angle is a little bit more extreme on this side. And guess what? This is my tighter hip, the one that I always have to work on. So you might find some asymmetries in yourself as you do this process. But if you can't perform either of those two tests and check that box, then this is probably a really, really simple place to start. Is just addressing that hip mobility. Now keep in mind, some people can still have a good squat even if they can't check the boxes on both those hip screens. And that's okay. This isn't a one-size-fit-all. It's not a black or white kind of pass-fail thing. But if you're looking to improve your squat and you improve your mobility for your squat, and those tests you cannot pass, it's probably a real easy way to make a big change with some simple interventions. If you're not sure what those simple interventions are, stay tuned for some future videos because we'll try to walk you through those steps.